There are a number of reasons why patients may need corneal surgery, but the most common ones tend to be due to trauma, infection, injuries, and anything that can lead overall to corneal scarring and opacity. So the cornea basically is the most anterior portion of the eye, and it sits in front of the cataract. Any opacity within the ocular media that doesn't allow light to enter clearly in a focused manner to the retina can cause blurry vision. So even though both corneal opacity and cataract can both diminish vision, the treatment for them is different, and the location of the problem is in a different place. Typically, corneal surgery is required whenever glasses or certain kinds of contact lenses can no longer compensate for the problem in the cornea and allow the patient to see well. Some of the more common infections that lead to a patient requiring corneal surgery include contact lens-related infections from things like Pseudomonas. Sometimes there are fungal infections from injuries that occur from organic matter like wood or plant matter. And sometimes it's due to certain kinds of viruses like the shingles virus or the herpes simplex virus. We're lucky to live in an era where there are different forms of corneal transplantation. 50 years ago, there was only one way to do it, and that required removing the entire cornea and getting a donor cornea from the eye bank and replacing that cornea in its entirety. But now we have multiple ways of dealing with specific problems related to the cornea. For example, if someone has damage only to the most posterior layer of the cornea that's responsible for keeping it clear and free of fluid, we can just replace that layer and leave the rest of the cornea intact. I would counsel everyone that's working on projects that may lead to kind of shrapnel formation or objects blowing around in their environment that can enter their eye to wear some kind of protective eyewear.